Hello there. I'm Dr. Thomas Gerber, the Associate Editor and Web Editor at Mayo Clinic Proceedings. I'm also a Professor of Medicine and Radiology at the Mayo Clinic College of Medicine. Let me tell you what you need to know about the Editor's Choice and Highlights articles in the December 2015 issue of Mayo Clinic Proceedings. Remember that you can access the articles that I'm about to share on our website for free at least during the month of December, and some of them even for 60 days. Our Editor's Choice this month is an original article about physician burnout. Dr. Tai Chanafeld and colleagues from Mayo Clinic and the American Medical Association compared surveys performed in 2011 and 2014 that measured burnout and assessed satisfaction with work-life balance of both U.S. physicians and a probability-based sample of the general U.S. population. I guess you won't be surprised to hear that burnout and satisfaction with work-life balance in U.S. physicians has worsened from 2011 to 2014. The authors actually found that more than half of U.S. physicians are now experiencing professional burnout. Take a look at the article to see how colleagues in your subspecialty have fared over those 3 years, and especially to read the suggestions that the authors have to remedy burnout and to improve work-life balance. The Editor's Choice article is coupled with an, I think, very insightful editorial entitled Dealing with Malady Among the Nation's Healers that was written by our Editor-in-Chief, Dr. William Lanier, and Dr. Dan Ariely, who is a professor of psychology and behavioral economics at Duke University in Durham, North Carolina. One of our highlights this month is once again part of our ongoing symposium on neoplastic hematology and medical oncology. This time, Drs. Young Park and Mario Eisenberger from Johns Hopkins University in Baltimore, Maryland, review advances in the treatment of metastatic prostate cancer. The authors also provide perspectives on new insights into androgenic receptor pathway activation, tumor microenvironment interaction of bone metastases, anti-tumor immunology, and new oncogenic pathways on which these advances are based. You can get up to 1 hour of CME credit for reading the symposium article if you complete the appropriate documentation, as always. And you can also get CME credit for our second highlight this month about the evaluation and treatment of low back pain. This clinically focused review for primary care specialists was written by Dr. Michael Hooton from Mayo Clinic here in Rochester and Dr. Stephen Cohen from the Johns Hopkins School of Medicine in Baltimore, Maryland. They provide the reader with a clinically focused framework for organizing key historical and physical examination findings that drive the diagnostic and therapeutic decision-making processes in the routine care of adults with lower back pain. And our third highlight in the December 2015 issue is an original article that relates the Mayo Clinic experience with 1,000 patients who had primary myelodysplastic syndromes. These patients were seen over a 25-year period, and Dr. Nassima Gangat and colleagues from Mayo Clinic in Rochester described the natural history of the disease, including presenting clinical and laboratory characteristics and long-term disease outcomes. Importantly, they also compare these outcomes between patients diagnosed before and after 2005. So read the article to see whether we've been able to make a difference in the prognosis of primary myelodysplastic syndromes in recent years. You can find the articles and the editorial that I just mentioned, and of course many other free articles on our Mayo Clinic Proceedings website at www.mayoclinicproceedings.org. On our website you can also find links that connect you with us on Facebook, Twitter, and YouTube, and you'd be joining more than 18,000 likes on Facebook and over 2,000 followers on Twitter, whom we're keeping up to date regularly on what's happening at Proceedings between the monthly issues. And next time I see you, it'll be a new year, and I'll be sharing about the January 2016 issue. Until then, have a happy Christmas and a happy New Year. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.